I'm going to move us on. Do you have any questions about pocket depth? Feeling pretty comfortable?
Yes.
Okay, we are at the end of the mode. Stretch, let the patient close their jaw. Everything all right? Let's quick tap advance with the foot pedal. We know that we had some zeros, so we'll say no.
Upper arch, furcation.
And it went into the next mode, in this case, furcation. Quick taps advance.
Midline.
Advance to 15. Oh, we advanced beyond it onto the lingual. We have two choices. We can use the undo button because it recorded a 0, or we can go into the moving mode. Let's go to undo. We're on the buccal of 15. The software knows it needs a multi-rooted tooth. It knows 2 sites buccal or lingual. Let's do a class 2 by holding and listening.
1, 2.
Class 1.
1.
Class 3.
1, 2, 3.
Let's advance to the distolingual of 3.
Midline.
And we pause. We confident in the upper arch?
Yes.
Advance.
Lower arch.
We refer to the monitor. Where did the cursor go?
31.
Buccal of 31. Class 1.
1.
Class 2.
1. Midline.
We wanted a class 2. We got a class 1. Our undo button works. Quick tap. And make it a class 2.
1, 2. Midline.
Good. Class 3.
1, 2, 3.
Advance to the lingual of 31 and pause.
Midline. Upper arch. Black.
Okay. You jumped through it. We wanted to pause. Now, we were okay with that, and that's fine. It's just a good strategy to pause because I can fix it with the foot pedal. If we wanted to make a change right now, we'd have no choice but to go to the keyboard and mouse. We're in the plaque mode. Quick taps advance. Advance to the distal buccal of 4. Hold and listen for plaque.
Black.
Again,
Black.
and again.
Black.
Plaque is a real quick mode. As soon as you hear a pluh, release on the foot pedal. Let's advance to 8, distal of 8, and we'll put 3 more sites of plaque on it.
Black. Midline.
Now we wanted the distal of 8. So let's go into the moving mode.
Okay.
You are in the moving mode.
Move your cursor back to the distal of 8. Center pedal back in mode.
Black.
Now that time when it said plaque, it was only putting us back into the plaque mode. Hold and listen.
Black.
Again.
Black.
Now you'll have to listen for plaque again on this one.
Black. Midline.
There you go. Very good. So we're at the end of the plaque mode. We pause as part of our strategy. If you're confident, quick tap advance.
Upper arch. Mobility.
And it moved into mobility. Quick taps advance and record a 0. So advance to 7. Record a class 2.
1, 2.
Class 1.
1.
Class
Midline.
1.
1.
Good. Advance to 15. Confident in the upper arch?
Yes.
Let's advance to the lower.
Lower arch.
Where did the cursor go?
Lingual of 18.
Because mobility is a single aspect. So let's advance to 22. Class 3.
1, 2, 3.
And advance to 31.
Midline.
Okay. Confident with mobility? Let's advance. Now we can select no diagnosis or use the side pedals. Let's use the side pedal to highlight slight periodontitis. Center pedal to select it.
Data collection complete.
Is the exam complete?
Yes.
No. We've got some recession that we want to do. And that's part of, remember, some people will actually do this as part of the implementation strategy. They'll turn pocket depth on only, do the pocket depth exam, which includes the dentition, and then when they observe recession, cycle around and turn it on. When they observe furcation involvement, cycle around and turn it on. When they see mobility, cycle on and turn it on. That's another strategy for helping with the time. Okay? So let's say no, we're not done. and use your side pedal to highlight recession.
Upper arch, recession.
Excellent. On our patient, our first significant recession is where?
Number 3.
Okay, so let's measure 3. We insert the tip, contact the margin, step once, CEJ, step again.
3,
Okay, and it advanced to 4. Recession on 4, measure it.
2,
Excellent. Let's advance over to 11. Quick taps advance and record a 0. And let's measure that big one on 11.
three,
You're doing great with recession. Let's spend a minute and talk about the ergonomics of the foot pedal. Okay? Let's go ahead and set the model down because we're not going to need it. And I haven't seen you work yet around the chair. And I don't know how much that you move around the chair as you move. But it's important that you take the foot pedal with you as you move around the chair. You want this foot pedal farther away from you than you think. If it's too close up underneath you, your foot and leg is in a bind, and that's very fatiguing. So go ahead and pull that around for your use. Okay. Now, I want you to rest your foot and close your eyes. Just feel that foot pedal.
lower arch,
Do you see how little movement it really takes?
Mm-hmm.
That's going to do a couple things for you. It's going to minimize you moving around the foot pedal and misstepping, but it's also a lot less fatiguing on your leg over the course of the day. It's going to take some practice, but when you're in the mouth, you don't want to keep looking down to your foot to see where it is, and it's all part of resting in the ergonomics of that foot
Right.
pedal. Okay? We're at the lower arch on 18. Let's advance to 31.
midline,
Does that help with the foot pedal?
It does, yes.
Okay. We're at the end of recession. Are you confident? Let's
Confident.
advance.
data collection complete,
Now is the exam complete? Yes. So we can say yes.
Okay.
It's now saved to the database, took us to our print options. We select what and how many we want to print, defaulted to what we did last time, and we can send it to the printer with the foot pedal, just stepping on the center pedal. And it's gone.
upper arch, you are in the moving mode.
Did excellent with that patient. Now we can move on and start doing some live patients.
Great.